Of course, for some of the mothers, as you heard there, it's all jubilation and excitement, but at the same time, you think about this issue of underage pregnancies, and there's about a 12-year-old in the province of the Eastern Cape, for example, who gave birth today. And there's now an investigation that is underway. At the same time, remember, there is that court case in Limpopo of a 13-year-old who was said to have been impregnated by a 28-year-old man, a 15-year-old in Mpumalanga, and then in KwaZulu-Natal, you're hearing of 16-year-olds. So certainly this again brings into the spotlight the issue of teenage pregnancy and what is to be done. I mean, if a 12-year-old is to have a child as young as 12, how then are they able to carry to term a baby? But what happens, especially when it comes to those days when we don't have cameras that are going to these hospitals? It's not Christmas, it's not New Year's Eve, it's any other day. Are those stats being recorded, and do we know who is impregnating these young people? And one such province as well that is also now launching an investigation into another underage pregnancy is the Northwest, and that's where Premier Lazarus Mokgosi has ordered an investigation onto possible statutory rape after a 16-year-old teenager gave birth at one of the local health facilities in the Kagisano Molopo Local Municipality. And the Premier joins us live now. Premier, Happy New Year to you, and thank you so much for your time this afternoon. Firstly, let's talk more about this case and your demand for an investigation.
No, thank you very much. This morning I visited Joe Morolong Regional Hospital, and I was doing the welcoming of the new babies, and upon arrival I realized that among the 4 that were delivered this morning, one is from a mother who is about 16-year-old from Kagisano Molopo. And from where I'm sitting, immediately I realized that there is a serious challenge here. It means there is what is called a statutory rape. And this will warrant a serious investigation so that we come to the final details as to who is the father, at what age is the father, and at what age was this child got pregnant, because if she delivered at 16, it means possibilities are that she got pregnant when she was around 15 years old. And therefore, for me, this is a matter that has to be referred to the police. And okay, thank you.
Pardon me for coming in there. Is she cooperating with, the information? Is she telling you how old is the father and all the other details that you may be looking for?
No, definitely. There is a social worker attached to the ward. They call it a post-natal ward, and she has been cooperating as far as ensuring that we get the necessary information. But what she's not sure of, and I think we believe, is the age of the father, but she does declare who is the father, the residence of the father, the name of the father, but she said, I don't know the age of the father. So it's something that we believe that it's worth praise. We will be able to deploy our teams to go to the ground and look for the father and be able to go through, including Home Affairs, to find out when was this father born and all those things. So a whole investigation is underway.
I do understand that this is her second pregnancy. Am I correct?
You are correct. Upon me putting my nose on the issue, I was then told, in actual fact, the Premier, this is the second child. And it said to me, the first child is about 1 year old. So it means when she was still breastfeeding, she then got pregnant with the second child. So effectively what it means, she could have got pregnant when she was 14 years old, delivered when she was 15, later in 15, she got pregnant, delivered when she was 16.
Is it the same father?
I can confirm. Come again?
Is it the same father?
No, it's not the same father. And the first father of the child was 15 years, according to the record, at that age when she delivered the first child. And it means that they were all below the age of consent.
Sure. And did this not raise alarm bells? I mean, for the healthcare workers or the people that were helping her, did it not raise alarm bells as far as the first case was concerned?
It does. It does give us a boost, and I think it really said to us, our systems to a large extent are not that tight, and but the report says even this second one, she was not attending any prenatal assistance to her pregnancy. She just came on and having delivered from home, and it's the same trend even in the second child.
Sure, and really that also begs the question then as to where are the family members? What are they saying?
The mother is there, but to a large extent, the mother also is cooperating. But she appears to be helpless and say, "This is what I see." And these children, we speak to them, they don't listen, and when you speak to them, they become so angry, and they become violent, and they use this vulgar words and to others. So it's some kind of a helpless society. And I believe if as parents we have lost control of our own kids, it becomes very difficult for the government, including schools, including the community, to be in control of our own children.
And it also speaks to the issue of, what you've just touched on right now, the systems that need to be tightened, because if the first pregnancy takes place and then she comes and she delivers, and yes, the father is also underage, but alarm bells are not going off for some of those who are assisting her in order to understand what exactly is going on here. It does speak to the fact that systems need to be tighter now in order to deal with this issue of underage pregnancies.
Definitely. We'll have to look at the high raising level of our teenage pregnancy, because I believe if the approach is not multidisciplinary in approach, we'll have difficulty, because this can't just be an issue that is health related because people came at the last stage to a health department. The Department of Social Development, Department of Education, private sector, churches, and so on. All of us, we need to have a final way of how do we approach this high level of teenage pregnancy. And I think it has become a serious concern in the province.
Premier, I have to ask this because there's also the blesser phenomenon that we're hearing about in that particular province. Where is social development?
When we were celebrating the World HIV World AIDS Day, I made a very important profound statement. There is a serious correlation of the new infection, because if you look at the HIV/AIDS infection, it's between the age of 16 and 21. And that means it says our young people are starting to indulge sexual activities at that tender age. And therefore, when you look at that new infection and you look at the high rate of teenage pregnancy, to a larger extent the effect of the blessers also come into the picture, where there is a high level of use of alcohol, drugs, and abuse, and so on. And therefore, we believe that it's a phenomenon that we need to look into. But the reality is that social development has programs that they are doing in different societies in terms of ensuring that our young people take care of themselves, our young people protect themselves, and our young people are aware of the dangers of involving themselves in early stages of their lives with sexual activities. But the issue is the impact. What we should be analyzing is what is the impact of the programs that we are putting before our communities and our society. And that analysis will then tell us that do we need to review our strategy? Because what we are dealing with may not be helping in terms of the program that we are putting before our community. And I think it's something that I will be focusing on in this new year to say what policies do we have, what strategies do we have, because it seems we are not succeeding with what we are doing.
Premier, before I let you go, while you talk about the programs as well, how concerned are you? Because there are other parents who are saying that social media possibly does play a role in some of what we're seeing, and maybe we might need to look at regulating it somewhat.
Well, I'm not sure to what extent we'll regulate social media as it comes to our kids, because they are engaging, and when they are out of our homes, because most of the time they spend it outside. I think what of importance is how do we positively use and get also into the space of the social media? on a positive sexuality education and awareness with our kids so that we are unable to retreat and be at the forefront with our programs using the same social media, competing for the space for positiveness in terms of the wellness and the life of our children.
And I suppose then as a final question, especially when you talk about social development and the programs that are now being put in place, I suppose there now needs to be a way to trace, the children that are giving birth, especially because these ones you were able to see, you visited the hospital, it's New Year's Day. And even on Christmas Day, it's easy to follow because the cameras are there, the officials are there. But on days when it's not New Year's Day, it's not Christmas Day, there are children that are giving birth, and certainly we need to track those as well.
For sure. But the nice part with this is that in health, there is a social worker attached to a maternity ward. So as these kids give birth, already there's a social worker attached. Therefore, what of importance is how do we report, how do we consolidate the information and make the necessary referral report, and how do we trace and ensure that we brought even justice to the whole process of our consolidated reports.
It's one thing, Premier, to say that there's a social worker attached, but what is the social worker doing with the information that there's a 12-year-old giving birth, there's a 15-year-old giving birth, because we should be seeing quite a number of cases then that are open.
To you guys about your working on New Year's Day. Is that fine?
Premier?
Is that fine?
Yes, I think that's what I'm saying. I agree that we do have structural arrangement, but of importance is what are the intended objectives of this arrangement. If there's a social worker there, and these things happen and they are reported, why are we not seeing logical conclusion of the process of having social workers there? And I think that's what we need to tighten. And I agree with you that we should be seeing a number of cases appearing in court of such people, or arrest of these blessers or these people who are overage, who are abusing our children, even within our own families. Because some of these cases arise out of family reliance.
Premier, I hope we speak again. As you say that now it's becoming your issue of focus. Let's see how much progress are you then making when it comes to this particular issue. But thank you so much for your time. Appreciate it. That it is the Northwest Premier Lazarus Mokgosi. It really just boggles the mind, and it's really just worrying, especially when you're listening to a story of a 16-year-old with a second child, and there's now different fathers, and it speaks to this issue of children having children and whether or not it's the correct approach that is being applied here. But we'll certainly continue to follow this particular story for you, and still hoping to speak to Ntandokazi Chapos, the Eastern Cape Health MEC there, where a 12-year-old gave birth in the Eastern Cape, hoping to really just get a sense from her as to what exactly happens now and how far does she now go to towards addressing this particular matter.